with Dr. George Liu. For some of you who are not aware, Dr. George Liu actually specializes in women's health, and I know he has a lot of success story with women's fertility also, even with our staff. So yeah, he is the person to go to for women's health. So this afternoon he's going to give a talk and expounding more on women's health and how TCM, how acupuncture can help to with issue on women's health. All right, so let's welcome him. Sit back and listen to his talk. Another thing, sorry, Dr. Liu, he's a very well-liked instructor in this school, and he's the instructor to start with clinical training for new students. The first clinical training lesson is beginning theater 1 and 2. So he is the instructor doing this. All right. So for students. Thank you, Dr. Liu.
Good afternoon, George Liu here, and I've been serving at the Five Branches University for past close to 15 years now, and previously I was teaching at the Los Angeles, the Empress College, which is also like a top 5 TCM university in the US. Women's health. It's a very how should I say it? It's a very popular topic among the TCM or every medicines right now. So in Bay Area, there are approximately about at least 15 to 20 minimum Western medicine clinic specialized in infertility. That's including, for example, Stanford, UCSF, and Kaiser as well. So while after you graduate, to pursue in the women's health and infertility is a big market. And during the pandemic, since like 2020, many people actually, because it's specialized in the Bay Area, that we have more people working in Silicon Valley. Instead of going to office, they stay in home instead. So the infertility or trying to get pregnant, the expectations actually is higher than before. So this is a good topic that we can start with. And I know that the women's health and infertility is a very, very big topic. Normally when we talk about in our doctoral class, or it's think about the whole semester to step in, but I try to cover as much as possible today within the next 45 minutes. And then if you have any questions, we can discuss, you can ask me afterwards. I know that likely that I won't be able to cover everything today, but hopefully that if you become opportunity to discuss together, okay? All right, so fertility. What is the fertility? People thinking that the fertility is like hard to get pregnant. Mostly in the old days that the people like blaming on the females. Right here we focus on the female more, but I'm going to talk about a little bit of the male infertility as well. So under the definitions of the American Society of Reproductive Medicines, that under 35 years old, if you have regular intercourse without using contraceptive for 12 months, that's the definition of infertility. But if you over 35 years old, they narrow down to about 6 months of the regular intercourse without using contraceptions, okay? And then surprisingly that I was born in Taiwan and I was taught in Taiwan as well too. in the United States right now, there's approximately about between 90-11% of couples that have the infertility issues or the needs to get pregnant. So our topic right here is women's health today, but is this all women's issues? So the fact is that among that we did the study of it, so 32% is male factors. We're gonna talk, if we have time today, we're gonna talk a little bit about the male factor today. But otherwise, if you add up those percentage down, you're probably looking at about 27-28% for female issue. Male factor is 32, which just means that 1/3 is a male factor issues. So to be fair, in order to get pregnant, it's a 50-50% responsibility between a male and a female. Okay? So we're gonna talk about that. And then right now that with you guys hearing about infertility, when you go into the Western medicine doctor, what they do, first of all, they do blood work, and then they ask you to go through something called IUI, and sometimes go into IVF. So some people maybe know what IUI means, some people don't know. So IUI is inseminate, like in uterus inseminations, means that they will have the male partner to go to the clinic on the day of the female ovulation day. And then they will have the sperm collections or the semen collections on the day off. And then the laboratory actually will do something called the sperm wash. Means that they will put it in the machines and then make it spin for like about an hour. And then the quicker of the swimming sperms, that will actually become like on the bottom of the tube. So what they will do is they use a catheter going down and then suck it up probably about 0.5 millimeter of the semen, and then mix with the natural semen together and inject into the women's uterus for hopefully that will get pregnant. And then after trying couple IUI doesn't work, and then they will move on to in vitro. So I think that a lot of people know about in vitro now. So in case that you need to know more about the technology right now regarding the IUI, IVF, we can talk about this afterwards. But is IUI, IVF a solution? Not really. So right now you can see that, the NIH showing the study that, for the IUI, for women under 35, is only about 11%. And then if you try multiple times, it increased up to like about 19.4%, it's still less than 20. We just talked about getting pregnant. We're not talking about the live birth yet, okay? And then the next is that on average, internationally, the first IVF cycles only has like about 40% success rate. So you think the IVF is also a solution? Not necessarily. And when they move on, as the issue more identified and addressed, the potential for success subsequent cycles, second one or third IVF, they probably can increase up to 60%. So where's that 20% coming from? So, which means that the doctor can change the protocol, but that 20% is also maybe also supported by the Chinese medicine doctor in the recent years, okay? And then, the Society of the Reproductive Technology states that for women under 35, their first time IVF X-rays, they probably for maybe only like a 20 but 30%. So what I'm trying to say is that when you try to get pregnant, women's health is very important. My job, also in my clinic, also at the school, when we talk about anybody who coming try to get pregnant, we not only helping them to get pregnant, but the things we try to educate them to have a better reproductive health. That's our purpose, okay? So not only like a treating for the acupuncture or Chinese herbs or other stuff like that. In order to give them fish, we rather teach them how to fish. Okay, so that's part of the lecture today that we try to discuss right here. So when we move on to that, and then you see the females, there's a couple issues right here. For example, tuber diseases, like a 16.7%. Endometriosis. Anybody know what endometriosis is? If you guys, anybody who actually maybe not fluent in English, endometriosis 子宫内膜异位症. Okay, so most of the time the endometriosis, like what experiences that when you have your menstrual cycle and female will experience like an excruciating pain. But TCM that we actually categorize in different patterns due to those pain. So we can discuss a little bit later. Also that the tubal diseases means that it's maybe actually related to endometriosis. I think that the 3% should be added to that tubal disease together. Because endometriosis means that there's extra tissues in the uterine lining. That if the lining getting to the ovarian tube, the fallopian tubes, that could cause tubal disease. One that maybe block it. So a lot of people that, I have the blood test from my Western doctors, and then as well as my male partner, the semen itself like look totally normal. And then also the female factors, is all the factors are not there, like the numbers are totally good. Guess what? We normally ask them to get tested for if the tubes are open. You may think that the Western doctors should know that. Actually, no, I just saw the patients that over on Wednesday did a consultations in my clinic that she tried 3 IUIs already and unsuccessful. And then I asked them, did your doctors ever try to, do something called, they could use the dye injecting the uterus and then into the fallopian tubes and then using the X-ray, right? It's called the HSG. And then they said, I never get it done before. Have you ever done studying sonography? They never done it before. It's like, you think that Western medicine doctors know about it? No, not necessarily. But I take that back a little bit. Sometimes they don't want to do that is because they probably will pursue you to doing IVF because that's where this is coming from. Okay, all right. So if you have like tubal diseases, that's also part of it. But the thing is, like in the Chinese medicine, we will talk about that. What factor? How can we help on those tubal diseases? And then the multiple factor females only, we're going to talk about like, for example, PCOS, things like that. Polycystic ovary, and I think that if you guys don't know what polycystic ovary is, do you? You guys know? Okay, so yeah, this polycystic ovary may be one of the like more of like a popular cause of the infertility as well. All right, so like I said, so male and female actually they are together added up. So never, pinpoint at the whether it's a female issue or a male issue. The funny thing is that I'll just share a funny story. Like every time when we do a consultations for the two gender couples, and then when they're coming in, if it's on a Saturday, and then if you have like a female, the wife or the female partner shows up only, likelihood when you look at their the background numbers, you probably will find like a semen analysis, and then they have issues on the male part. Because the males sometimes have like, a high, self-esteem, it's like they don't want like, and then by the time they shows up, they normally gotta be quiet, so they rather not coming in. But, if the day of that, the consultation, the couple shows up, a lot of times the male just look like this. It's like, yeah. So it's being like seeing the fertility patients for the past like almost 20 years, like you've seen all kinds of stuff. So okay. Anyway, so let's talk first about the female infertility first. So the common cause, like I said, the first one, so like PCOS, polycystic ovaries. So what can lead to polycystic ovaries? So number one, we see a lot of the hypothyroidism. So you guys know that there's a hormone called TSH, right? Thyroid stimulant hormones. So when the hormones is not functioning, then you have hypothyroidism. The hyper opposite is that you have your metabolism too quick. So hypo means that patient coming in always looking tired and things like that. So in Chinese medicine, we talk about this called the qi and yang deficiency. So what is qi and yang? So a lot of people talk about what is qi. So you guys, some of you are start getting into the T's here. What is qi? Qi, you can look at two things. So the way that we're looking at right now, the qi is like the growth energy. That means we were born and then we start growing and we grow taller and then we have a puberty and then we start making our reproductive organs and reproductive, the next generation things that and then die. That's the qi that generate from when we first birth. But right now it's like bioenergy as well too. So a lot of time right now that what's bioenergy, that we can see that the things that flow inside. Why our heart is pumping? Why are some people who have like a hypo, like blood pressure, like some people who have hypertension, things like that, and then some people why they have like a hypothyroidism. That there's a cause because of the qi, this energy is activated or is not activated. So that's what we call a qi in order for you to understand. But Chinese medicine also about what's yang deficiency. So things about the Chinese medicine, if you guys, I saw the book today right here. For you who are interested in the Chinese medicine 101, this is a very good book to start with. It's called The Web That Has No Weaver. It's almost that has like a very simple TCM theory about it between the yin yang or the 5 elements. Okay, I actually got this book able to download it in my computer for free somehow. I found that. So if you guys want to do a search a little bit, you can. But a lot of people like the paperback. So this is actually a good book. You can get it from Amazon for less than $20, I think. Okay. So in order for you to understand maybe in the future regarding qi, blood, or you talk about the yin yang 5 elements, highly recommend about this book. So yin yang means that yin can be like a passive energy. Yang can be more of an activated energy, means that it's more of fire, more of heating. So yin means that could be cooling. So in order for you to understand where's your yin yang in your system, if we talk about an animal, if we put our hands as the feet, put on the ground, anything that sun can touch, right? That's talk about the yang. That means the fire. That means the sun. Yin means that the sun cannot get into us, means that underneath. So more of here. So that's to give you a little bit about the yin yang, like a quick theory. Same thing. Anything there's about right and wrong, right? So right and wrong. What's yang? What's yin? We don't know about it. But the thing is, everything there's always two-sided. So that's yin yang. Okay. So hypothyroidism. When you have the slow metabolism in your system, that means that it could causing polycystic ovaries. The other part is the obesity. So obesity means that it could be due to the hypothyroidism, or it could be due to for example, eating disorder. So people who like to eat a lot of the chips and those junks and stuff like that, eat a lot of carbs. So carbs is one of the bad thing because people are thinking about carb. Carb is actually sugar. Okay, it's the double sugar. It's even worse. So it will create a phlegm and dampness in our system. And then the phlegm is something we call obstructions, like a phlegm. So just like any of you. So I'm not sure if you guys noticed, after you eat a lot of sugar, you drink a lot of the milk, right? And then maybe 15, 20 minutes later, you feel this phlegm in your throat. That's where it's coming from. That's the phlegm. Okay? But the phlegm can be obstructed in our system because it's not flowing, all right? And then cold drinks and food, of course, we talk about like maybe similar to obesity, but I think a lot of people that have the cold drinks and food issues because they think they're okay. I have, multiple patients that are coming in, their numbers look totally fine, and then, sometimes you ask them that, hey, do you get menstrual cramp? Yes, I do get menstrual cramp. But a lot of times that they think that menstrual cramps are normal. Well, menstrual cramps are not normal. Okay, so when you have your menses, you suppose just be, oh, it's coming. Okay, you notice maybe like a 1 discomfort, like 1 to 10, 1 on 10 scale discomfort. That's it. That you know it. But the thing is, anything more than 2, is not normal. But TCM again, when you have like a pain, then TCM looking at, oh, what kind of pain do you have? Where's the pain is? But most of the time, that if you go into the Western medicine doctor, if you have excruciating pain, they don't care about the reason. They just say, oh, you have endometriosis. That's not quite right. Okay. So especially when you have like a cold drinks and food, and you get a cold uterus, means that the cold uterus means that you may have a slow metabolism locally. Remember, we talked about the phlegm and dampness earlier. So when the damp and the phlegm, look at this. If you have a flow of water, I always like to tell my patients, like, just imagine this, like if you go travel, let's say that you go travel overseas like more than a month, right? And then your first thing when you come home, turn on the faucets of your, in your kitchen, things like that. Maybe for maybe a second, you probably see some gooey stuff coming out first before the actual water flow. Okay, that's we call it stagnations. The stagnation, that is becoming, we call it the dampness and the phlegm. Okay, imagine that is in your circulation system, that when you getting cold, that everything's slowing down, and then the things obstruct inside. That created a lot of obstructions. So the easy part can be the PCOS. The hard part we're going to talk about next is, which is endometriosis, even worse. Okay. And normally that in our the practical that we see that people may get, like when you ask them regarding like a vaginal discharge. So what's vaginal discharge? So we have cervical mucus around our ovulation time. We don't see those like the white, egg white, sticky substance around the ovulation time. Those are normal because those are estrogens. But other than that, like after you have the menses in the first 10 days of your cycles or last 10 days before your menses start, at those times you're not supposed to see any substance down there. But when you're seeing that those like a discharge, then that's abnormal. For example, if you see some clear or white discharge, yeah, some people say, yeah, I do see that, but actually that's bacterial infections. Okay, so when you see yellow, that's even worse. All right, sometimes you even can smell it too. So whenever you get that, that means we call it, in Chinese medicine, we call it lower jiao damn cold. When you turn it to yellow, we call it damn heat, but the thing is we talk about PCOS right now, so we just talk about lower jiao damn cold. So in TCM medicine, we talk about 3 trunks right here, upper, middle, lower. So what's the upper? Same thing that in the future when you come in as a students that we're going to teach you like a diagnosis. So you see that the TCM doctors always use the 3 fingers to take the pulse, right? So the first fingers always represent the upper. So that represents the heart and lung. That's where the above the diaphragm is. And the middle part is almost like similar to where our diaphragm is. So that's the stomach, spleen, liver, gallbladder. Okay? And then the third finger, which is we're using the ring finger to touch on the third position, that's the lower trunks. So lower trunks is where the large intestines, small intestines, bladder, and then we talk about the reproductive organs, such as like the uterus, ovaries, male reproductive organs as well. So when we talk about the lower jiao damn heat, that means that in the future you guys will hear a lot of this terminology, that the lower jiao damn cold heat is down there. So one thing that when you talk about when you talk to your patients regarding, oh, I have menstrual cramps. So one symptom that they're able to tell them that whether they have cold uterus or not, you can ask them that whether you are able to relieve the pain with the hot water bottle. If using a heat pack, it helps. 99% of the time, yes, that's cold uterus. Sometimes not, but I think 99% of the time it's cold uterus. So in our Chinese medicine, we try to everything talk about what is a TCM can help on women's health or fertility, blood circulations. So blood circulation increase, help feed the ovaries, so make the follicle growth. Blood circulation will feed the uterus and then make the endometrial lining thicker, right? So that's help the implantation, things like that. But whenever you have cold uterus, things like that, so we talk about this. Number one, sometimes when you go into the infertility doctors, they say, oh, everything's fine. Even I have the beautiful lining. So over 9-10 millimeter. Perfect, okay. So let's say that you have a ball, you have a bowling ball, okay? That's, you will consider your embryo, right? And then implantations. So we throw down to a mattress. The mattress has catch it, right? So there's hard mattress and soft mattress, right? Which one gonna catch the embryo faster or catch the ball faster? The soft mattress, because that's bouncy, right? But the thing is, that the mattress, the mattress, the thickness is the same. So how do we make that mattress easy to catch the embryo and for the implantation part? Make it softer. But guess what? The cold uterus, the muscle spasm. So they make the muscle tougher to actually catch the embryo for the implantation part. So that's one of the reasons why that we not talk about, there's so many unexplained that, the infertility issues. That's the part that the Western medicine doctors never can explain or never can tell them why, but we can. Honestly, if I see a patient today that walk into my clinic about, okay, so the numbers, females, everything's correct, and the male, everything's correct. And then the doctor say, the doctor sent me over here, but it's unexplained. You know what? That's what our TCM specialty is. We explain. But when the doctor come in and saying that, the patient have, for example, one missing fallopian tubes or have unicorn uterus, things like that. You know what? That's tough. But things is able to treat, but thing is that's tougher. So the TCM's specialty is that we do a lot of things that Western medicine cannot explain. Okay, and I call the Western medicine doctors, their Western medicines regarding everything is number medicines. Chinese medicines, or we call it Oriental medicines, we are philosophy medicines. So we explain a lot of things to the buyer. I'm just telling for example, that mattress versus the bowling ball part. Okay, but it's easier for you to catch why that we focus so much on the blood flow. Okay, doesn't matter by using the Chinese herbs or acupuncture. Okay. I give the put the herbs down there, so some of you actually have a TCM background, know the herbs are, but some of you guys don't know, then you can skip that. We're gonna talk about this again if you become a student. We're probably gonna have a fertility class in the future. But the last part of the PCOS, the reason is that high estrogens. And then we call the liver constraint. So then what's a liver constraint? Means that when you are eating so many junk food, processed food, and then most of the processed food contain estrogens in there, the phytoestrogens, as well as the products that you use, maybe for example, shampoo or environmental toxins. And then where those toxins goes? The toxins actually, this is agreed between the Chinese medicine and also Western medicine, because the liver is our detox organ, one of the major detox organs. So you actually have to get your liver passage to detox, right? So when you come into the liver constraints, I put it right here at the end, Zhenzhou, Aizhou, we do not give herbs on that. We only using acupuncture or moxibustion Anybody know what moxibustion is? Some of you guys know, right? I do, okay? So moxibustion is like we're using the herbs called mugwort and then making it into stick. And right nowadays that is actually being processed into like a charcoal form, so there was no smoke, but you still can smell it. The old days, like it just like a very smoky, look like a cigar. But the thing is like, that is like a heat to apply it on the acupressure points that will help, like very similar to the acupuncture effect. So the reason why I put the only acupuncture and the moxibustion is that most of the Chinese herbs sometimes contains estrogens. So if you have high estrogens, you know, when you talk in the future, when you're talking to your the TCM practitioner, if they try to give you the herbs, make sure understand what the herbs that they give it to you, because 50% of the time the herbs contain the estrogens. Okay, so if you have a high estrogens, like more than 50 on the day 3 of the cycle, try to avoid them. Okay. All right. So the next topic, endometriosis. So endometriosis, that means that there is extra tissues grows in your uterus. So a lot of time that the tissues is like kind of like can take too much away of the blood flow, or kind of like, for example, you know, the Apollo 13 want to land on the moon, but I think land on like, you know, the rough surfaces and then fail. So that's what it is. We supposed has like a smoother landing spots for our embryos. So when you have like endometriosis, that means that your endometriosis is inflamed. So a lot of time that people talk about, like, for example, like pelvic inflammatory disease, PID, that could be anything. A lot of time that people experience that, you know, in the past, they were able to they got pregnant themselves, but the things they go through like multiple abortions. If you're going through like the medicated abortions, sometimes incomplete aborted, so the tissues still remain inside. Or you probably sometimes go into a DNC or DNE because of the equipment, causing the scar inside the uterus that could lead to the uterus being damaged, that we call it a local blood stasis. So in the TCM that we can using the herbs or sometimes the acupuncture to activate, to kick out those like the blood stasis. And then again, we going back to that cold drinks and the food before the menses. That actually causing a lot of problems. So number one, we talked about earlier is like because the menstrual cramp, right? But the thing is also that I was yelling at my daughter the other day. My daughter just turned 13 now, so she had her menses for a year already. So there's one cycle that she actually it's my fault too. So we went camping, and then during camping, you cannot eat too healthy over there. So we allow kids, you know, a bunch of kids together, they want to, you know, eat some ice cream, things like that. But I totally forgot about her menstrual cycle. So that pretty cycle, she has menstrual cramp. And then that was her day 2 of her cycle. I didn't know it because I didn't, as a father, as a fertility specialist, that I sometimes, you know, pay attention to her, you know, also my wife, like, sorry for the male guys, okay? Yeah, and a little bit of the script right here, because I can see that they're using the past and not throwing around. So I think that because it's we are the camping spot, but I didn't see she using the pads. So that day, that actually not only she was eating, we went river rafting. That was like back in August. So river rafting in Sacramento, the water is coming from where Lake Tahoe is. The water was cold and freezing. So my daughter was complaining that, yeah, I have menses, but it stopped today. It's abnormal. So that means that the shedding was not completed because the muscle spasm. So we call it the 冲任 qie blood stasis due to the tissues incompletely shedded out. And then actually extra tissues stayed inside, become inflammatory, could be in the future. So the next cycle, make sure that when she knows that her cycle is coming in, and then we stop doing that, and then I was doing like an abdominal massage for her to make sure that the cycle, the completed shedding. That also means that we do sometimes like an abdominal massage, means, remember when you try to paint the wall, right? You try to scrape the opening first. So that sometimes there's a lot of old scar tissue inside causing the infertility issues. So that's I want to explain to you. So I put this little red silent endometriosis. This is actually a new topic that I try to share with you guys recent years that the Western medicine doctors also, they create so many things to help themselves that explain why that, the IVF is unsuccessful. So you probably will see that, okay, I don't have any menstrual cramps, during my cycles. Everybody builds differently. So they say, I don't have any pain during my cycle, so I don't have any endometriosis. Okay, that's one. So the Western medicine doctor right now, they do two things before the IVF transfer. If they see like multiple failed IVF or failed IUI, during the ovulation time, they do two things. One, they call ERA test. They try to see that, whether, the progesterone is needed or not during the IVF cycle, and how much like progesterone to give it to you, and when to do the IVF on the transfer day 5 or day 6. The other part is they started to do the called receptiva. The receptiva is another test also. They will grab tissue out of uterine lining, and then they will do tests and see that your tissue is inflammatory. Yes, if you have inflammatory tissues, they probably either they probably will do another like laparoscopy to just make sure that if you don't have endometriosis lining in there, or that maybe they put you on letrozole for suppressing for like about 3 months to quiet down your uterus before the transfer. This silent endometriosis was able to tell by the TCM long time ago. So we don't have any the Indian patients here, or sorry, not patients, the guests here. So in the Bay Area, we have a lot of ITs here, so you guys can tell that a lot of Indian decent IT work in the Bay Area. So and the same thing that we have like patients or guests here, maybe from Korea, maybe from China, Sichuan area. They like to eat spicy food. Indians, they love spicy food, and then Koreans, they eat spicy food. But their weather over there, the climate over there is hot or very humid. Okay, so when they eat spicy food, right? So that when they eat spicy food, they're able to sweat and discharge of the extra dampness in the system, which is great. Okay, but we're in California. California weather is what? Dry. Okay, so if you are still eating those spicy food, spice level just compared to what it used to be back in, Asia, those like eating more of like a bamboo, or people like from New York or like Florida, if they're eating more like spicy food, which is okay because their weather very similar to what we were talking about in India or those like Southeast Asia, things like that. And then, what are those spicy food can do? So again, when you become like the TCM students, that you will learn in the channel. The channel, what is channels? So I always describe that. The channel is like a freeway, highway combined together to connect between the cities. That means connect between our organs internally. So there's the two major highways that actually go through our reproductive organs. Number one is the liver, number two is the stomach channels. So whenever you eat too much of like a spicy food, I have actually 5 things I will say. Not only spicy food, fried food, flame barbecues. Okay, those are your taking notes. So fried food, flame barbecue, spicy, jalapeno spicy or sriracha spicy type, okay? And then dairy products, as well as sugary products, so sweets, carbohydrates. The worst part is the gluten. Okay, the gluten. So those are 5 inflammatory factors. So when you are having that issues, you likely will see sometimes an unexplained infertility, or you probably will get tested from the silent endometriosis, say, I don't have endometriosis, but I've been tested positive for Receptiva test. Why? Go back to the food list that you have. That may be why. So, of course, we try to, people can come back to me saying that, hey, spicy food or fried food is heated. So didn't you just say that you want a circulation? I don't want to overheat it though, okay? So a lot of time that you can look at this, you can go home and look at the mirror yourself and see how red your tongue is. If your tongue is red color, red, almost red like this color right here, that means that you have so-called blood heat. That means it runs in your system. So you may want to ask yourself, maybe adjust your diet a little better. Okay, I only have about maybe 5 minutes left, so I can let you guys ask a question about it. So the next part is more interesting part is the unexplained. So what is unexplained? So we can explain, but the thing is, most of the time that it's unexplained, we categorize into our liver. Remember what I said earlier? This is kind of quiz right now. Which 2 channels go through our reproductive system? Stomach and liver, right? Good. Okay, you guys able to come into my class now. Okay, so liver channels. So liver channels, not only the channels, but also the organs, right? So we said earlier, so it's a detox organ, right? But the detox organ not only detox something that you're able to see, but it's invisible ones. For example, stress, depression, mood swings, right? So these are also, we call it a liver constraint. And the other part is the alcohol drinking, right? So alcohol, everybody know alcohol damage your liver. So no brainer, okay? And then the last part is very important, the sleeping. When you go into Western medicine doctors, or often that in our clinic, that first time the patient walks in and say that, oh, how's your sleep? And they just, sometimes was like, oh, I have my 8 hours. And then your next question, what time do you go to bed? I said, I go to bed at 1 o'clock, but I work from home, so I'll get up at 8 to 9 o'clock, so I have a 7 to 8 hours sleep. Unfortunately, that our liver and gallbladder start refreshing, rejuvenate, and then doing the detox, self-detox process at the peak hour between 11 to 3 o'clock at night. So a lot of people are night owl, but the things they keep telling me that, oh, I have my 8 hours. Yeah, but you have the poor 8 hours. So here is, again, between the Chinese medicine versus Western medicine. Western medicine, 8 hours. That's the number of medicines. But Chinese medicine, we talk about the quality as well. So if you're able to sleep 6 hours, let's say that from 10 to 4 o'clock, versus somebody sleep from 1 o'clock until 10 o'clock next morning, 9 hours, that 6 hour wins, for sure. I bet you on that. So a lot of time that the sleep or the insomnia problem is the silent cause of the infertility. So we keep telling our patients that you should go to bed by 11 o'clock. By all means, in case that you are not able to fall asleep, let's say that you have insomnia issues. So I'll urge you to do 2 things. One, at least turn off all the lights. Okay? Don't use your phone. So right now that 3C products like computer, tablets, iPads, or your phone, that's your worst friends. Okay? So 11 o'clock, turn off everything. Because of that, you want to allow your body to start producing melatonin. And for those people, sometimes I had another patient at the consultation on Wednesday saying that I cannot help it because my job is, she's a nurse. So her job is like from 7 p.m. to 7 a.m. So I urge those days that when she sleeps the off hours, try to take a little bit of melatonin. Actually helpful because you help your body to prevent and then help your body to get some melatonin for the one that you missed the production from. Okay, so again, why this is important? Because the Western medicine keep talking about the quality. What is the egg quality? So at the end, the IVF, let's say that you have 20 eggs that you can see from the ultrasound. Not all 20 will fertilize. But after the fertilize, not everyone will grow up to day 5. And after day 5, they will send into the chromosome test. And when it came back, you probably only have 1 or 2 or none. Then you know why. That in Chinese medicine, the Western medicine have no way to fix that problem. But Chinese medicine, we categorize into the liver issues. So in order to promote the liver detox, we sometimes talk about a couple of things. One, you can do abdominal breathing at night. So when you start doing the abdominal, so look at this. Everybody try to take a deep breath right here. If your shoulder start popping, that means you're using your lung to breathe. Nothing wrong. When you're doing a cardio, nothing wrong. But however, where's our reproductive organs? Down there, right? So when you try to do the abdominal breathing, the bottle breathing, just feel yourself that your shoulders are not raising. But when you are using the abdominal breathing, when you're breathing deep, guess what? You expand your diaphragm. And what did I say earlier about the middle jaw? The liver gallbladder underneath. So when you exercise your diaphragm, you're actually pumping your liver to the detox. Okay? So sleep early, practice on your abdominal breathing. Okay? Because this is actually the true quality coming from. I will touch a little basis on the quality part. So why this is important? Remember earlier we talked about the male factors. This is 1/3 of the problem, right? So I'll just give you a quick look on I'll skip to that part real quick regarding the male factor. Give me a sec. There you go. So male factors, normally that we look at a couple of things. We look at the semen volume, we look at the sperm, the counts, right? And then also motility, and the last part is the morphology. Okay, so the male fertility, semen volume is easy. So basically that, I'll put it that at the end, it's like dehydrations, okay? So if a person who actually exercise and then they don't drink much water, you probably will see like low volume. But the thing is like once you drink lots of water, especially like if, for example, like electrolytes, probably will help. The other part is the sperm count. The sperm count is very easy. So basically you just need to supply the patient with a lot of zinc, or as long as it's not genetic issues. So you supply with a lot of zinc, for example, shellfish, hemp seeds. And then the Costco is selling right now the goji berry. The goji berry right now is very, very helpful because that's probably one of the highest antioxidant and also can stimulate, there was something called Leydig cells in your testes to produce the sperms. Motility, you just need to exercise, do some cardio. But the last part, morphology. So morphology is the shape of the sperm. That's what it means. So everybody knows that the sperm look like, right? Little head, little tail, right? But the thing is like when you're under a microscope, you probably will see sometimes like the cone head, like look like alien, and sometimes like a short tail, too long a tail, split tail, things like that. So those are the ones who have the morphology issues. So, but the thing is, the good thing about Under the male fertility is much easier because they are able to identify the wrong sperms from the microscope. So they are able to pull that individual sperms out and then doing something called ICSI. But a female, when you're doing an IUI, IVF, or things like that, you know what? When they do ultrasound, they look at it, all the follicles look exactly the same. You cannot find out the quality until you do the we call it the hormone, sorry, the genetic testing, the pre-genetic testing. So after you found out, it's like, oh, okay. Or if you try to go for the IUI or natural birth, and you know, after 10 weeks right now, we are able to do some testing to find out whether you have the genetic issues. If yes, then what? We have like, you know, most of the people are willing to terminate the pregnancy and then start over again. And that's what, how many times, probably lost about 4 to 6 months after recovery. Okay, so again, like I said, when we look at that morphology issue, I do like a little survey in our clinic. So a lot of people, it's like the 3 things. Number one, they either drink alcohol, smoke, or sleeping late. This concept applied back to the female as well. But what the topic is that liver. Okay, so it doesn't matter if it's a Western liver or a Chinese medicine liver. So liver is very important. So remember today, after you take from this short sessions, that make sure that you ask yourself, your friends, your patients in the future, things like that. 2 things you have to really be careful about: stomach and the liver. Okay, so stomach, remember with the 5 things that we're not supposed to eat, right? And then liver, okay? Sleep early and then avoid things that you're not supposed to. All right, so I have far more information like to share, but the thing is, due to the time, I'll leave like next 5 minutes like for you to ask questions, and then I'll answer at my best. Anyone? Don't be shy. No? Go ahead.
I just had a question about sleep. There's a lot of research in Western medicine around trying to improve sleep.
Mhm.
And I like what you said about sleeping early because of better quality
Mhm.
in the cycle. If someone has insomnia though, and they just wake up periodically in the night, is there a way with TCM to sort of help with
Oh, yeah.
reducing that?
Yes, because sleeping involves a couple more organs. So remember we talked about the 5 elements, right? So the 5 elements, if you guys don't know about, is like, for example, the wood, earth, metal, fire, and water. Okay, those 5 elements we have. So multiple times that the sleeping problem. So if you have the hard time to fall asleep in a TCM, we normally categorize into the liver issues, falling asleep. But if you have a hard time to maintain sleep, for example, I often ask questions like, you know, okay, so do you wake up at night? Yes. Do you wake up at night to use restrooms? Yes. Were you able to go back to sleep easily? Yes. So if that's the case, you know what? Because you just have like drink lots of water and get up and using the restroom so that's normal, right? But if you have hard time to, you know, to hold your pee at night, so number one, because you're getting up to pee, and then you didn't drink much water, that's a kidney, right? So that's, you know, involved with the bladder, so they're together. But if you sometimes like you have vivid dreams, so you just have like, you know, constant like vivid dreams. We call it the swing issues. Most of the time, if you look at the mirror yourself, you look at the edge of the tongue, you can sometimes see teeth mark. And then some people have like the nightmares. Well, either have nightmares, and then when they stick out their tongue, you can sometimes have like red tips in their tongue. Yeah, what's called the hot fire. Yeah, and then they have like a sleepless night, just like toss and turns a lot. Ask themselves what time do they eat the dinner, or sometimes what did they eat for dinner. If they eat something, like I said, spicy, or like fried, or they eat so late, the stomach will keep stirring the heart, so that throughout the whole night, even you sleep, you probably didn't have a sound sleep either. So yes, TCM for the insomnia, we're good at it. I have to say. Okay. Anyone else? Yes, go ahead, please.
In the beginning of your presentation, you
Uh-huh.
looked at the infertility rates in Taiwan
Uh-huh.
and in the US and
Right.
other countries.
Right.
So are the countries that are practicing more of the Chinese medicine less, is the fertility rate less of an issue than the countries that practice more Western medicine?
Interestingly, in Taiwan right now, that I cannot say that about for China, but I guess very similar. But the thing is, we have to look at, for example, the Western medicine versus, the Chinese medicine or, alternative medicine, I should say, the rates. Because in China or in Taiwan, the TCM considered as not alternative, is considered as a mainstream medicines. So people can get the treatments for the TCM, they have choices without spend too much out of pocket. But however, in the United States, like I said, I even have like a lot of patients that have insurance. But it depends on if the insurance coverage, they cover the acupuncture or not. So they are able to receive the TCM treatments, otherwise it's out of pocket. So for some developed countries, of course, but the thing is, it depends on insurance as well. Did I answer your question on that? No, not really.
Not really, but thank you for that explanation.
Yeah, but because of the technology it's kind of big topic because, for example, in the US now that we talk about the fertility rates, right? So more of the developed country, the infertility rate may be higher because of the workforce, things like that. They have their stress is higher, things like that. So less developed countries maybe have lesser the rate of infertility. However, also need to talk about the infertility treatments, in those countries too. But because the developed countries, for example, US is a very developed country, but however, the FDA actually limit on some of the medication to use versus the Asia in Taiwan that they're using the growth hormones, almost they can use as much as they want. But FDA actually right here has limited. So it's kind of give and take. Yeah. Yes, that will be the last question that I have, sorry, because I have to let you guys go for the next event. Go ahead.
Thank you for the informative lecture, Dr. Liu. I was sorry if you said this at the beginning of the lecture.
Uh-huh.
What classes do you teach at IUI?
Oh, I teaches couple classes. For example, I teach elective. The one thing called master tone means that there's a different style of the acupuncture, but the thing is there's one traditional ones, the called master tones that I'm specialized in that one. Two is that I have to say I'm more of a practical person than a theoretical person. So I teaches most of all the practical classes. Means that when you are in the clinic, so start from ground up means that Liz just introducing. You guys have a different levels of the internships from beginning to the graduates from, we call it a theater, then becomes a rounds. So rounds is a smaller version of a theater, okay? So theater, this semester I have about 35 patients, 35 students, sorry, keep saying patient. So 35 students. Then the rounds class is about 5, so it's kind of a mini theater. And then after rounds, then you are upgrade yourself to so-called intern rounds. That means that a supervisor will watching 4 students to needle the patients in person in the room together. But then after that, then you become so-called an internship, means that the students are become more of a senior. They are able to see the patient themselves, and they will come to the supervisor for approval, but they can just come up with their own treatment plans. I supervise all 4 levels, so basically, yeah. Thank you. Alrighty, so I will leave the rest of the time with Liz and then tell you where you guys will go next. And then I will hang out for like maybe like next 5-10 minutes right here, just in case you have any fertility questions. Otherwise, I hopefully see you in the future, okay? All right.